So if an individual is 5'8" and weighs 175 pounds, that individual is going to be considered overweight. If they're 200 pounds, they're obese, meaning their BMI is over 30. And if they're 275 pounds, they're going to be considered class 3 obesity or having a BMI greater than 40. And that's important because obesity really is a continuum. The more weight that you have, the higher the risk you have for complications during pregnancy.
Obesity is what we call a heterogeneous disease. That means there are different causes and the different types. Not all obesity is bad. And there are different people who may even appear to be thin but may have what we call internal obesity. And hence we look at different measurements of obesity. Based on this, there are different causes. Some of them could be because a child is born with a genetic defect. However, most obesity is acquired later on in life and due to a combination of factors such as lack of sleep, medications that could have added weight gain, or other components in the environment that we are still learning about, such as a sitting job, issues with menopause, or conditions with mental illness that definitely predispose an individual to weight gain. Very often it also could be because the parents were overweight and hence the child usually suffers with this from the time they were a small child.
In addition to the change in our environment and lifestyles, there are other factors that promote weight gain, such as genetics, medical conditions, stress, certain medications, and poor sleep can also promote weight gain. Having an unhealthy weight can lead to other problems. It raises risk for diabetes, high blood pressure, heart disease, and stroke. Excess weight is also associated with high cholesterol, sleep apnea, fatty liver, joint and back pain, and even some cancers.
Hello, my name is Chad Greeter. I'm an assistant professor at the University of Iowa Carver College of Medicine. I grew up in a small Midwestern town as the son of a farmer. I left the farm to go to college and ended up pursuing a PhD at Vanderbilt University in biomedical research focusing on cardiovascular disease. From Vanderbilt, I went to UT Southwestern Medical Center in Dallas as a postdoctoral fellow where I continued my research in cardiovascular disease, but I wanted to look at the effects of obesity and diabetes on the heart. Our lab has developed several tools that we use to study how the heart responds to different disease states. Using these genetic tools, we asked the question of how obesity was affecting the heart. And in doing so, we made a serendipitous discovery that the heart is actually able to regulate systemic metabolism. So what this ultimately means is that we can potentially use this aid to learn more about how the heart functions in response to different disease states, but more importantly, we can use this as a tool to potentially provide a therapeutic strategy to treat not only cardiovascular disease, but obesity and potentially diabetes as well by targeting one system to treat all three. The long-term goal of my lab is to understand the molecular changes that occur in the heart in response to diseases such as obesity, diabetes, hypertension, and ischemia, with the ultimate goal to treat these major diseases.
Let's talk about the different treatment options for obesity. We'll talk about first diet and exercise, we can talk about medications, and lastly, surgery as an option to treat obesity. Diet and exercise is a means to help lose weight. However, for many people, it's very difficult not only to lose the weight, but to keep it off. For example, many of my patients will lose 30 pounds over the course of a year, but 1 year after that, they've gained that back plus another 30. So while diet and exercise does work for a lot of people, it's also very difficult for others. So there's also weight loss medications. Medications are designed really to help curb your hunger, or maybe to help increase your metabolism. There are some side effects associated with medications, so again, make sure you speak with your doctor. The third treatment option for obesity is surgery. Weight loss surgery or bariatric surgery is a viable option for many people. There are a few different surgeries that are available to people to help them lose weight. You must have a certain BMI to meet the qualifications for surgery. For example, your BMI must be 40 or greater, or 35 or greater with an obesity-related illness. These surgeries are things such as the lap band, the gastric sleeve, or the gastric bypass. You must be healthy enough to undergo a major operation, so make sure you speak with your doctor to see if surgery is an option for you. Those are 3 different treatment options for obesity.